Charlie was 68 when something in his routine started to feel quietly wrong. Not dramatically wrong. Not the kind of thing that sends you rushing to the emergency room. Just wrong enough to sit in the background of every morning like a low, persistent hum you can't turn off. For 11 years, his days began the same way. Before sunrise. Before the house stirred. Before the world outside had even decided what kind of day it was going to be. He would wake up with a pounding headache that seemed to pulse behind his eyes, a tightness in his temples that made him press his fingers against his skull as if he could physically push the pain away. His hands would tremble slightly, not enough to drop a cup, but enough to make him notice, enough to make him uneasy. And there was always that feeling. Not pain exactly, not even fear. Just a quiet, unmistakable sense that something in his body wasn't right. He did what responsible people do. He followed instructions. He took his medication exactly as prescribed, every morning at 8:00 a.m. without fail. He never skipped a dose. Not once. It had become automatic, like brushing his teeth or locking the door before bed. His doctor adjusted the dosage a couple of times over the years. Nothing drastic, just small tweaks. Well, fine, tune it, they said. Sometimes it takes time. Charlie accepted that. Aging, after all, comes with its own set of negotiations. You expect things to change. You expect your body to be a little less cooperative than it once was. So he adapted. But the mornings didn't change. At 50:00 a.m., almost like clockwork, his body would revolt. The headaches, the trembling, the quiet dread. His wife would sometimes find him sitting at the kitchen table in the dim, early light, elbows resting on the surface, fingertips pressed into his temples, waiting for the storm inside him to pass. He told himself it was just part of getting older. His doctor called it poorly controlled blood pressure, and for 11 years that was the explanation. Until one small, almost insignificant question shifted everything. Not about the medication itself, not about the dosage, not about diet or exercise or stress, about timing. What time are you taking it? That question hadn't come up before. Not really. It had always been assumed. Morning. Of course, morning. That's what everyone does. But this time, instead of adjusting the dose again, they tried something different. Charlie moved his tablet from 80 in the morning to 90 at night. Same medication, same dose, same diet, same light, same life. Nothing else changed. Within 2 weeks, the difference was undeniable. The headaches disappeared. Not reduced. Gone. The tremor in his hands faded into the background until it stopped registering at all. The 50:00 a.m. blood pressure readings he had been tracking for years dropped by more than 20 points. 20. For over a decade, he had been waking up at the exact moment his body needed the most support, and his medication was at its weakest. That's the part most people never think about, because we tend to think of medication as a constant, something steady, something that, once taken, simply works throughout the day. But your body doesn't operate on a flat line. It moves in rhythms, and one of the most powerful, least discussed rhythms in your body happens before you even open your eyes. Between roughly 40:00 a.m. and 100:00 a.m., your body goes through a dramatic internal shift. It's not subtle. It's not minor. It's one of the most intense physiological transitions you experience in a 24-hour cycle. Hormones surge. Cortisol rises sharply, preparing your body to wake up and engage with the day. Your nervous system shifts gears, becoming more active, more alert. Blood vessels constrict slightly. Your heart rate begins to climb. Your blood becomes a bit thicker, a bit stickier as clotting factors increase. Your blood pressure rises. Not gently. It surges. For someone with well-regulated blood pressure, this is manageable. The body handles it the way it was designed to. But if your baseline is already elevated, that surge starts from a higher point, and that changes the equation. Now imagine this. You take your medication at 80:00 in the morning. By 50:00 a.m., the next day, nearly 21 hours have passed. Most medications aren't designed to maintain peak levels that long. By that point, the concentration in your bloodstream has declined significantly, which means that at the exact moment your body is under the greatest cardiovascular stress, your protection is at its lowest. That gap matters more than most people realize, because the early morning hours are not just another part of the day. They are, statistically, the most dangerous window for cardiovascular events, heart attacks, strokes, sudden cardiac issues. They don't occur evenly across the day. They cluster in the morning. That's not a coincidence. It's biology. And once you understand that, the idea of timing starts to feel less like a minor detail and more like a missing piece. For decades, the default instruction has been simple. Take your medication in the morning. It sounds logical. It fits neatly into daily routines. It's easy to remember, but that recommendation didn't originate from a deep understanding of circadian biology. It came from something far more practical. Convenience. The earliest blood pressure medications, introduced in the mid-20th century, worked primarily by increasing urine production. They flushed excess fluid from the body, which lowered blood pressure. The problem was obvious almost immediately. When taken at night, these medications caused people to wake up repeatedly to use the bathroom. Sleep was disrupted. Patients became frustrated. Some stopped taking the medication altogether. So doctors shifted dosing to the morning. And it worked. Patients slept better. The recommendation stuck. Over time, it became standard practice, passed down through generations of medical training, reinforced in textbooks, repeated in appointments. But medications have changed. Modern blood pressure treatments often work through entirely different mechanisms. They don't necessarily carry the same nighttime drawbacks. Yet the timing advice remained, not because it was always optimal, but because it was familiar. Meanwhile, research began to explore what happens when that timing is adjusted, not in theory, but in real patients. Large-scale studies tracked thousands of individuals over several years, comparing outcomes based on when they took their medication. Morning or evening, same drugs, same doses, different timing. The results weren't subtle. People who took their medication at night often showed better blood pressure control during sleep, more stable readings in the early morning, and in some cases, significantly reduced rates of cardiovascular events. Not universally, not for everyone, but enough to raise an important question. What if timing isn't just a detail? What if it's part of the treatment? Because your body doesn't just need lower blood pressure. It needs lower blood pressure at the right time. During sleep, your body is supposed to enter a state of relative rest. Blood pressure typically dips. Heart rate slows. Blood vessels relax. This isn't passive. It's a critical recovery window. Your cardiovascular system uses these hours to repair, reset, and prepare for the next day. But for many people, especially as they get older, that dip doesn't happen. Blood pressure stays elevated through the night. The body never fully gets that period of relief, and over time, that constant strain adds up. The heart works harder than it should. Blood vessels remain under pressure. Organs that rely on steady circulation, like the kidneys and brain, operate under less than ideal conditions. You don't feel it immediately. There are no obvious symptoms, but the effects accumulate, quietly, consistently, night after night. Shifting medication timing can, in some cases, help restore that natural dip. It aligns the peak effect of the drug with the period when your body needs it most. It provides coverage during the early morning surge. It supports the natural rhythm instead of working against it. But, and this part matters, it's not a one-size-fits-all solution, because not all medications behave the same way. Some are specifically designed to increase urine output. Taking those at night would disrupt sleep, which introduces its own set of problems. Sleep fragmentation affects hormone balance, increases stress responses, and can actually raise blood pressure the following day. Other medications influence heart rate directly. In certain individuals, taking them at night could slow the heart too much during sleep. That's why this isn't about making a sudden change. It's about understanding the pattern, about asking better questions, about recognizing that the when can be just as important as the what. And beyond medication, there are small, often overlooked habits that influence what happens during the night. What you eat in the evening, how you sleep, when you drink water, what you expose your mind to before bed, All of these factors play a role in how your body transitions into that overnight state. Certain foods, particularly those rich in specific compounds, can subtly raise blood pressure if consumed late in the evening. Sleep position can influence breathing patterns, which in turn affects oxygen levels and cardiovascular stress. Fluid intake close to bedtime can interrupt sleep cycles. Even emotional stimulation, news, arguments, intense conversations can keep the nervous system activated long after the moment has passed. The body doesn't separate mental stress from physical stress. It responds to both in the same language: hormones, heart rate, blood pressure, which means the hours before sleep are not just free time. They are part of the preparation phase for rest, for recovery, for the next day's stability. Charlie didn't change his diet. He didn't start a new exercise routine. He didn't overhaul his lifestyle. He just asked a question that hadn't been asked before. And that question led to a simple adjustment, one that aligned his treatment with his body's natural rhythm. After 11 years of waking up in discomfort, he began to wake up feeling normal. No headache, no trembling, no quiet sense that something was wrong. Just morning, simple, calm, unremarkable. And sometimes that's the most powerful change of all. Because when something has been part of your life for so long, you stop expecting it to disappear. You adapt to it. You normalize it. You stop questioning it, until one day you do. And that question opens the door to something different. Not a miracle. Not a dramatic transformation. Just a better alignment between what your body needs and when it receives it. And sometimes that's enough to change everything.